Hi, my name is Carl Freeman, student nurse at Miles Community College. Today I will be demonstrating how to give a Rocephin intramuscular injection using the Z-Track method. First, we want to go through the 6 rights of medication administration. You have right patient, right drug, right route, right dose, right time, and right documentation. We will document at the end of the procedure. Next, we want to verify the physician orders, which have been verified by a student nurse, as you can see. And we're going to check the MAR to make sure it coincides with the prescriber's order. I'm going to wash my hands, and I'm going to apply a pair of gloves just to be safe. Next, I'm going to take off the cap of my diluent and the cap of my powdered medication. I'm going to grab the syringe in which I will prepare the medication. I am going to grab a 22 gauge, 1.5 inch needle. I'm going to apply it to the syringe. I am then going to grab an alcohol wipe, and I'm going to clean the top of both my medication, powdered medication, and my diluent. I am now going to take off the needle without the cap without touching the needle. I am going to draw the air from my powdered medication. According to the label, we want 5.6 milliliters of diluent added. So we're going to add 5.6 of air. There we are. I'm going to inject the needle into my diluent. I am going to inject the air without letting the needle touch the liquid. I am then going to turn it over at a 90-degree angle. And I am going to draw 5.6 milliliters. I'm going to make sure I don't have any bubbles. I am now going to add this to the powdered medication. I'm actually going to add another needle. Oh, maybe not. All right. Once I have the medication in there, I'm going to begin to rotate. I'm going to throw my needle into a sharps container. Now you don't want to shake it because you don't want an excess of bubbles, but you do want to make sure that all the powder is reconstituted. So we're going to just take our time making sure that this medication is mixed. Sometimes it takes a little bit, but you don't want any powder stuck to the bottom. You want to make sure that all the medication is mixed. Medication looks mixed. I'm now going to Now I'm going to prepare the medication using a new needle and syringe. Now, the powdered medication states that 500 milligrams is equal to 1 milliliter. We want a gram, so we're going to draw 2 milliliters. I'm going to recap using the one-handed technique here. Maybe. Okay. Now I'm going to enter the patient's room. I'm going to wash my hands and I'm going to apply a new set of gloves. I want to verify the patient's identification using 2 identifiers. So I will ask Mr. Rocker his full name and date of birth. He will say, my name is Skip Rocker. I was born January 1st, 1972. Now we know we have the right patient. I'm going to take an alcohol wipe. And we are going to inject this Rocephin into his vastus lateralis. So he will need to either be sitting or in the supine position. Mr. Rocker is now in the supine position. We're going to take our alcohol swab. We're going to wipe the area that we are going to inject. When using the Z-track method, you're going to place your hand on the muscle and you're going to pull back in between 1 to 2 inches. So I've chosen the site, I have cleaned the site. I am now going to pull back, inject the medication. I'm going to stabilize the needle, and I'm slowly going to inject the medication. And I'm going to release at the same time. I am now going to take my needle and drop it straight into the sharps container. I'm going to take off my gloves, I'm going to wash my hands again, and I'm going to come over to the MAR and I'm going to document that I have given the medication. Now the other step we want to take is we want to label the Rocephin so that we know what diluent we used, the amount of diluent we used, and so the next nurse will know if it's still good to use or if it's expired. So I'm going to come over here. I'm going to grab a orange medication label. And I'm going to write the date, the time, the amount of diluent added, my name, and I'm going to check policy to see the proper way to store this medication. Thank you.